So both prolotherapy and PRP are in a great new field of medicine called regenerative medicine, which can be highly effective. But unfortunately, there's a lot of people who aren't doing it as completely as I prefer to, because you see, it's still part of a comprehensive treatment plan. Hi everybody, Dr. Dan Williams with you. Today I'd like to talk to you about prolotherapy and PRP, or platelet-rich plasma. So both of these treatment techniques at a basic level kind of do the same thing. And when we're looking at a patient possibly needing prolotherapy or PRP, we're looking to go in and strengthen the ligaments and the tendons around the bone. So think of ligaments and tendons as the rubber bands that hold your bones together. Those bones have to be together to keep us upright and to help us move. And so over time, and when we damage our ligaments and don't properly rehab them, what happens is we get a little bit of slack in the bones. And that little bit of slack over time changes the way the bones wear. Then we start to get bone spurs, we start to wear out the cartilage inappropriately, we start to wear down the meniscus in our knee, and it sets us up for things like rotator cuff tears. So what do you do about these small, subtle ligamentous injuries? Prolotherapy and PRP are some of the most effective treatments that I'm familiar with to treat these. So for prolotherapy, we take dextrose, which is a sugar compound. It's an extract from corn. We take that, we dilute it down, add a little bit of numbing medicine, and sometimes a small amount of some other substances. And we inject that into the painful ligaments or the unstable ligaments that are leading to the joint problems. What this does is the sugar opens up some of the cells, and that starts the inflammatory process. So just like with an ankle sprain, the area kind of swells up and gets tender and sore. But we let that process happen because that is the inflammatory response that comes in and heals the torn ligaments and tendons. And so really what we're doing with prolotherapy is helping your body help itself. Rather than giving you a medicine to cover it up, rather than injecting a steroid, which is actually doing the opposite, we're actually trying to strengthen the tissue. So we're causing some tissue damage, and the body comes in, and when it repairs that damage, it lays down new tissue. So that's prolotherapy. Now, platelet-rich plasma is all over the news these days. Many NFL players, Tiger Woods, this is very popular. In fact, some of the staff in my office have had it done for rotator cuff tears and some other things, and we're getting great results with it. Works on the same idea in that we're trying to help your body help itself. But for PRP, we draw blood from the patient, your blood, we spin it down in a centrifuge, and we separate out the parts. Then out of your blood, we extract the platelets and the growth factors and the healing factors out of the blood. So those things that, like when you cut yourself and blood goes to that area, those things that help stop the bleeding and like make the skin grow back together, we're taking those healing factors out. So we're concentrating those, taking them out of the blood, and then we're injecting them into the damaged tissues, helping your body regenerate. So just walking in and having somebody do PRP on your shoulder, for example, isn't likely to yield the best result. When we do PRP or prolotherapy, we want to combine that with good rehabilitation, with good manipulation. We want those joints moving properly as you start to develop the new tension in the fascia and the soft tissues. Acupuncture can be helpful for pain control and also getting rid of trigger points. And then, of course, if we don't have good nutrition, if our vitamin D levels are low, and there's lots of other things that we check, then we're not going to get good, complete healing, which is what we're trying to do. So remember, whenever you have orthopedic injuries, we want to approach it from a functional perspective. Functional orthopedics is so important. And so that's why it's important that you find a physician that's familiar with all of those aspects to help you non-surgically manage your musculoskeletal injuries. So if I can be of help to you, give me a call or reach out to me on the internet. Come see us in Indianapolis, or we'll try to help find somebody in your local area. Thanks for watching. Bye-bye.